Thank you for joining Cancer Support Community Atlanta for Frankly Speaking About Cancer from A to Z, facilitated by Dr. Jill Rossrocker with Medical Associates of North Georgia and moderated by John Russell with Northside Hospital Sleep Disorder Center. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. If this is your first time participating, we invite you to complete a new attendee form to stay connected to all future programs.
Welcome everyone to today's program, Frankly Speaking About Cancer from A to Z, understanding how cancer impacts sleep and tips for getting a better sleep, with Dr. Rossrocker and John Russell. I'm Katie Armsby, the Program Outreach Director with Cancer Support Community Atlanta. If this is your first time participating in a Cancer Support Community Atlanta program, we invite you to visit our website, cscatlanta.org, where you can see a complete list of the virtual oncology programs offered. These include virtual support groups led by licensed mental health professionals, stress reduction classes like yoga and Tai Chi, a monthly nutrition seminar facilitated by a licensed oncology dietitian with Northside Hospital Cancer Institute, and of course, education programs like this one today. And if you ever miss a live event, we invite you to visit the video link on our website. You can find a recording of past events, and you can also watch some yoga classes and meditation programs there as well. So again, to register for any live event, we invite you to visit our website, cscatlanta.org, where you can get additional information. As a reminder, everyone will remain on mute for the duration of today's program. We invite you to enter questions into the program chat box, which will be addressed during the Q&A end of the program, time permitting. I'm excited to welcome today's program moderator, John Russell. John was born and raised in Memphis and graduated with an honors business management degree from the Terry College of Business at the University of Georgia. He has served as a financial advisor for 11 years at Merrill Lynch before joining Northside Hospital. John has worked in sleep disorders with Northside Hospital the last 10 years and now manages all 5 of their sleep centers. He lives in Canton with his wife, 2 kids, and crazy black lab. So welcome, John, and I'll pass it off to you to begin today's presentation.
Thank you, Katie. I certainly appreciate it. So Dr. Jill Rossrocker is a board-certified physician in internal medicine, sleep medicine, and pulmonary and critical care medicine. And she has over 2 decades of experience practicing. She joined Medical Associates of North Georgia in 2005, and she also serves as the medical director of our Northside Hospital Sleep Disorder Center in Cherokee. She has also been working to bring community awareness to the diagnosis and treatment of sleep disorders and sleep disordered breathing that is so under-recognized and undertreated. And just as a sidebar, I have worked with a lot of doctors over the years, and you know, one of the things that's always stood out to me about Dr. Rossrocker is her how she really treats the whole person. She is, not just the immediate complaint that you may have come in for. She's just a very big advocate of total body well-being. And so y'all are in for a treat to get to hear from her today. So excited for her to get to speak. So Dr. Rossrocker, with that, if you want to, the stage is yours.
Well, thank you so much. I appreciate the kudos there, John.
Sure.
And I've enjoyed working with John for many years now as well. So let's start by saying sleep is a passion for me, not only my own sleep, but teaching sleep and teaching the importance of sleep, not only patients with cancer, but all patients. There are 3 pillars of health that people need to be always aware of, and that is adequate restorative sleep, a nutritional plan that's along the lines of a normal BMI or weight, void of sugar for the most part, despite your weight, and some form of exercise, even 10, 20, 30 minutes a day of really doing anything. If people would just make the time to make those things happen, a lot of our chronic illness would go away, 30 to 50% of it. And part of that, doing those 3 things, is also anti-inflammatory and increases your immune system, which then leads to less cancer as well as less disease. So from there, we'll go forward. In doing some research for this talk, I came to realize that really the management of sleep issues is the same regardless of the cause for your sleep issue. So first we'll go through why cancer patients have more issues with sleep. And then we'll go through the management of that. But the management really is not different than management of people that have sleep issues for anxiety, depression, pain, fatigue. It's just that patients with cancer often have all of those issues at one time. Fortunately, or hopefully, a cancer patient will only deal with that for a short period of time or relatively short period of time, whereas other patients with pain may deal with that for the rest of their life. And so the management is a little bit different in a patient with cancer because the time frame of having sleep difficulties hopefully will be short. And we'll go through why that management is a little bit different. And I would encourage you to make use of the programs that were just described as support group, stress reduction classes, nutrition seminars, education programs. And in fact, I will probably give that resource to patients without cancer because all of those issues are great to participate in and to learn about. So trying to toggle through here, guys. There we go. Okay, let me toggle through these here. So we're gonna talk about the importance of sleep in general. As I said, sleep is important for all people in the world. It's critical to overall health and immune support. How cancer impacts sleep, optimizing your sleep practices, which is what we call sleep hygiene, talking with your healthcare team. This is where I think we'll go into it in great detail, but patients with cancer and the issues with cancer really need to use their healthcare providers to help them with their sleep and the things that are affecting their sleep, and then ultimately resources that you can turn to. So the importance of sleep. People do need 8 hours of sleep at least, and often with malignancy and treating malignancy, often that sleep requirement is greater. And you should sleep whenever your body feels the need to sleep. Your body is telling you, I need to rest, I need to restore, I need to re-energize, and we'll talk more about that. So sleep for all people plays a vital role in health, as I've said, and well-being. It affects your mood. People that are sleep deprived are cranky, they are not happy, they crave bad foods. Sleep deprivation is never a good thing. You don't think well when you're sleep deprived. Your immune system does not work well. Your blood sugars go out of whack, and your appetite craves bad foods, as I've said. So sleep is very, very critical in overall well-being. And unfortunately, in America, in the industrialized time that we live in, people tend to cheat themselves of sleep, but they're really cheating themselves from health by doing that. So how common is problems with sleep? Very, very, very common, even in someone who is otherwise healthy. 30% of people relate problems with their sleep. 75% of cancer patients report trouble sleeping, and almost 20% report a worse quality of life related to their sleep disturbances. I would say that that's much more than that. That's higher than the national average, which is about 30%. So what are the problems with sleep? You can have sleep onset difficulty where you're tossing and turning and can't quiet your brain enough to let yourself fall asleep. People have problems with sleep maintenance, waking up in the middle of the night and then having trouble going back to sleep for various different reasons. And again, people with chronic medical problems have this difficulty very commonly as well. And what we try to help them do is teach themselves to block their brain, reposition, and allow them to go back into their sleep mode instead of coming to full wake. When you come to full wake in the middle of the night, you've already had some sleep. So your homeostatic need for sleep is going to be less. So going back into deep sleep after getting up and doing some dishes or watching some TV, it's going to be very much more difficult to get back into deep sleep. So we try to teach repositioning, blocking your brain, getting in your sleep position, thinking your sleep thought, something very neutral, and allowing yourself to get back into sleep. People that have trouble sleeping, either sleep onset or sleep maintenance, we really try to avoid napping during the day because that deprives you of your homeostatic need for sleep as the nighttime comes. Difficulty concentrating, waking up early is very common in depression, very common in cancer patients as well. Obviously, sleep apnea is an issue separate from cancer, but if people have problems with snoring, stopping breathing during the night, making funny noises when you sleep, those are the people that need to be assessed for possible sleep apnea. And studies have shown that lack of sleep or sleeping too much, anything less than 6 hours, more than 10 hours, is felt to contribute to poor health. So how does cancer impact sleep? As I've said, many patients with chronic medical problems have maybe one or two issues that affect their sleep, whereas cancer patients often have multiple things that affect their sleep. Cancer patients suffer from fatigue that's almost universal, and that's a very difficult problem to manage because you want to sleep during the day, you want to nap. And in cancer patients, that's actually okay. And you should sleep whenever your body tells you, I'm tired, I need to rest and restore, as long as it doesn't affect your nighttime sleep too badly. Sleep-wake cycle is disturbed because of pain, because of medication effects, and difficulty going to sleep because of stress and anxiety and worry. All of these things are common in a cancer patient. So what are the things that a cancer patient deals with? Often people have treatment worries and effects, medication side effects. A lot of times steroids will make you more hyper and cause you to have difficulty going to sleep. Nausea, vomiting, GI side effects from chemotherapy are all very significant issues. People often have to go to the hospital, and the hospitals are never where you get any sleep for anyone. And we'll talk about that a little bit too. You can often ask your doctor to write an order saying, do not disturb this patient between 10 and 6 a.m. Otherwise, they will come in and take your vital signs, even though you're not unstable, and you'll be woken up all through the night. So those things can be requested from the caring physician or the prescribing physician. You can also request sleeping aids, anxiety medication, whatever it takes to help you manage the common issues that you're dealing with when you're a cancer patient, which we try to avoid if someone doesn't have a short-term sleep problem. If it's long-term sleep problem, we try to avoid medication and try to work more with cognitive behavioral therapy or behavioral therapy. Pain issues are very, very common. You know, your doctor can write for adequate pain medication to minimize pain at night so that you're able to sleep. Fatigue, unfortunately, there's no magic bullet for that. Oftentimes people are anemic, you know, they're tired, they're fatigued, and they need to be able to rest when they need to rest. But by the same token, it's very important to have some form of exercise in your day, even though you don't feel like doing it. It actually will improve your overall sleep pattern. Mental health issues, anxiety, depression, stress, all of these things are very real and can be managed not only behaviorally with support groups and yoga and meditation and things like that, but with medications in the short term as well. So treatment and medication side effects are very real, and we've kind of talked about that. Steroids especially affect sleep, but all chemotherapy can cause side effects that affect sleep. Radiation, chemo, hormonal therapy can cause hot flashes, and even without cancer, I can attest to how difficult that is in your sleep. Surgical pain, procedural pain. Often people are anemic, and that causes them to be somewhat more tired to begin with, much less everything else that they're dealing with. Pain medications make you sedated in general. Nausea medications also can cause sedation. So all of these things people with cancer often are dealing with, versus chronic other medical illnesses, which only usually have to deal with one or two of these things. So if you do have to go to the hospital for procedures or surgery or whatever the issue is, and you have to stay there for a few days or longer, it's very important to make your hospital room as close to your room at home that you sleep in as possible. We do this for children, we do it for adults. Comfort things, if I were to be in the hospital, I'd bring my own pillows. You want to get up out of bed if you're able to do so during the day, so that you're up and as active as you can be during the day, so that you are tired at night. A lot of times people in the hospital, they'll just stay in bed all day long and doze off on and off and on and off, and then they're unable to sleep at night, which is normal. If you're going to have sleep during the day, you're not going to need to sleep at night like you would normally do. So we want you to keep the blinds open, keep it as much like the real world as possible, keep the blinds closed at night, try to minimize interruptions from the nursing staff at night. And again, it's very much okay to ask for medications to be administered during the day that have to be administered, and then to ask for medications for anxiety and sleep if you need those things to try to create a normal sleep cycle. And following good sleep habits is the same for anyone with sleep difficulties. So pain is a big issue in cancer diagnoses, often pain from procedures, pain from surgery, pain from the cancer itself. Pain is a real issue, but we have very good medicines to help manage pain, and don't be afraid of using them. You need to control pain, not only for your overall well-being, but for sleep. Pain is a big reason why people wake up from sleep and then have difficulty going back to sleep, difficulty getting comfortable again. So ask for those things. You're not going to be looked at as a person, seeking drugs or anything. You have real pain, and that should be managed. So again, talking to your doctor, very important about how to effectively manage your pain. Talk to your doctor. We have very, very good pain management teams in the hospital and out of the hospital. And you have to work with your doctor and let them know what's going on, or they can't help you. They're not usually going to be the one to ask you. You have to be proactive and tell them, I'm having trouble sleeping, I'm having pain issues, I'm having anxiety issues, I'm depressed. We can manage those things behaviorally as well as with medicine, but we have to know what you're going through. Fatigue, that's a tough one. And I know there's some questions about how to manage fatigue. Fatigue is multifactorial, from anemia, from medications, from your body fighting the cancer, okay? Your body's working overtime. It's tired. You can't control that part too well because you're trying to fight the cancer, and your body has to do that. So just accept the fatigue. If you want to take a nap, take a nap. My brother had cancer. We were on vacation. He slept probably 15 hours of the day, but his body was fighting the cancer. So don't fight the need for sleep. If your body is saying, I need a nap or I need to sleep, give into that. That's your body saying, I need to restore, okay? And when you're in the throes of cancer and treatment, don't worry too much about, I have to go to sleep at 10 and get up at 6. Your body may not let you do that, and you need to not worry about it. Your body is going to take sleep when it needs it. I guarantee you, okay? And once you're over the treatment and over the illness, you can get back to normal again. But right now, in the throes of things, Just listen to your body, listen to what it needs. So again, fatigue affects sleep significantly. I think even more than these statistics report. I would say 80% of people were moderately concerned with their sleep issues and fatigue while undergoing treatment. So look at all these facets that contribute to fatigue. The primary cancer, your treatment, anemia, pain, your emotional state of having cancer, your family's emotional state of helping you deal with the cancer and worrying about the patient, difficulty with sleep, nutritional concerns, medications, inability to exercise like maybe you used to, hormonal changes in some people dealing with certain types of cancer. So you're dealing with these 10 things instead of just one or two that most people deal with when they're having difficulty with sleep. So just recognize it. There's no fix for it really, but just recognize that it will be short term. You'll get through it, and then you should go back to a reasonable normality. So how can you combat fatigue? Conserve your energy. Use it for things that you enjoy doing, like this person walking her dogs. Don't waste it on cleaning the kitchen or things that just don't have to be done right now. Leave that for other people. We want people to conserve their energy, maintain your energy. You do need to move. We don't want you laying in bed all day. Like I say, you should be up as much as you can during the day so that you will have preserved sleep at night. We talk about relaxation techniques, yoga, meditation, all those resources are available for you. And also keeping track, kind of like a journal of how you're feeling and talking to your healthcare team about the issues that you think they can help you with. So again, we talked about the mental effects of not only having cancer, but dealing with the treatment for the cancer, dealing with the constant, doctor's visits and procedures and this issue or that issue. It just feels like it's never going to end, but it will. And just understand that that's normal to have anxiety and depression about everything you're going through. I mean, it's completely normal. And it really helps to talk with other people that are going, so definitely join support groups. And that's true of any issue that people are going through, be it tobacco addiction, drug addiction, gambling. I mean, it doesn't matter what the issue is. It really helps to be in a group and talking with other people that may have ideas that they have found help them, that then can turn around and help you as well. Trouble sleeping, again, can impact your emotions. When you're having little sleep, you tend to be more distressed, more anxious, less able to make good decisions. So it all kind of fits together. So how common is depression? Very, very common. And don't feel like you can't talk about that. I mean, it's extremely common for people to have situational depression when they're dealing with cancer, just like the loss of a loved one or something similar, but even worse, really. So don't be afraid to talk to your healthcare provider about anxiety, about depression. We do have good medications in the short term to deal with these issues. So how does mental health issues affect your sleep? Well, it affects it very much. When you're under stress and having anxiety about your treatment or your diagnosis or your prognosis, it's going to affect your sleep. When we go to sleep, our brain doesn't completely shut off. Our mind is still kind of working in there. And if you are anxious about any issue, your quality of sleep is simply not going to be as good. So it's important to talk to your healthcare provider about your symptoms and potential management. And again, writing down things tends to help people kind of get their feelings out and try to get it on paper and help them understand what's really happening to them. Some people do this, some people not, but it's a good idea. So here's where optimizing your sleep practices is kind of universal with all things that affect sleep, all diagnoses, chronic medical diagnoses, all chronic mental issues, and just issues in general for people that have difficulty sleeping, which 30 to 50% of all people have trouble with their sleep at some point in their adult life. So sleep hygiene is our term for managing difficulty with sleep, optimizing your environment for sleep, optimizing your health practices for sleep, nutritionally, exercise, your things that you do during the day to help you with your nighttime sleep, and then your environment for sleep at night is very critical as well. So for most people that have issues with sleep, it's very, very important to be on a schedule. Same wake time every day, same bedtime every day to help entrain your circadian rhythm. You know, we were meant to get up when the sun came through the window back in, thousands of years ago, work in the field, work all day, sun goes down, melatonin kicks in. Sleep is very complicated. I won't even go into all of that part of it, but we have a very defined circadian rhythm. And we were meant to be able to have melatonin kick in when the sun goes down, go to sleep by 10 o'clock, and then sleep until the sun comes in the window the next morning. So we have a very, very complicated physiologic system for sleep. And again, it involves probably thousands of chemicals, thousands of pathways. And it's very important to maintain a schedule and follow a nightly routine. If you take a hot shower, hot bath before, getting ready for bed, reading in a dim light in another room, not in your bedroom. And then when you get into bed, we want the person to be ready to sleep. We don't want people to be on their phone, on their tablet, have the TV running. The room should be cool, dark, and quiet. There should be nothing in the bedroom except sleep, okay? When you get into that bed, your body, just like a baby, when you put the baby in the crib, you're telling that baby it's time for sleep, okay? It's not time to be doing other things, okay? We do the other things outside the bedroom. You have to try to reconnect your brain with, when I go into my bed, I'm going to sleep. There should be no clocks, no animals, with rare exception. If they're comforting to a person and they're not disturbing the person, that's fine. But sometimes the animal's routine, contributes to disrupted sleep. So fixed wake up time, prioritize sleep, don't cheat yourself from sleep, make gradual adjustments toward this system. And again, this is more important probably with a person that does not have cancer. Again, when you do have cancer and you're tired, take what sleep you can get and don't be disturbed that your nighttime sleep might not be perfect because of that. For a regular person without cancer, we do try to encourage them not to nap during the day. So again, keep your routine consistent. Budget time, like I say, reading something boring in another room, promoting, I just want to go into my bedroom and curl up in my bed with my 3 pillows and my earplugs and my mask and my sound machine. That's how I do it. Everyone does things differently. Dim your lights. Light is the most powerful wake stimulus that there is. So there's a reason the sun sets and then we go to sleep. Okay, so we don't want people doing electronics and light and TV and all this stuff at night. It does not promote helping you go to sleep. So if you want to do those things, do them during the day. And again, we want to manage pain in the nighttime, because pain, even for people that don't take pain medicine, for myself, for example, I have a lot of hip pain and it wakes me up probably 5 times a night, and I have to learn to reposition and not let thoughts in my head and allow myself to get back into sleep. One thing that last slide said is that if you do wake in the night and you don't have a clock, you don't know what time it is, but you think it's been more than 30 minutes, you're blocking your brain, you're trying to get back to sleep, and you haven't been able to get back to sleep, we want you not to be in the bed having anxiety about sleep. All that does is create more anxiety and makes sleep more difficult going forward. So we want the person to get up out of bed, go into a different room in an uncomfortable chair, read something very boring in dim light that you don't have any interest in continuing to read, trying to promote just getting back into bed, all the while trying to get up at the same time the next day so that the next night your homeostatic need for sleep will be higher. So we only want people to go to bed when you're actually ready to sleep. Stay active during the day. Like I say, don't sleep a lot during the day. Don't lay around in the couch or the recliner. Try to get up and be as routine for daily activities as you can. We don't want people drinking and eating before bed. We want people to exercise during the day. Like I say, a lot of people with cancer are so fatigued, they just can't even remotely think about exercise. But even just walking the dog for 10, 15 minutes, maybe go to Home Depot, walk the perimeter of the store. And we want the bed to be for sleep only, not other activities. Comfortable bed is very important. For myself, I need it to be very cool or I will wake up and I won't be able to go back to sleep. So cool temperature is very, very important. I have blackout drapes that helps immensely to minimize any light. And I use a sound machine. That's not really something everyone needs to do, but it does drown out other noises that may arouse you from sleep. So basically, we're trying to do everything possible to keep you from waking up. Because you're going to wake up anyway. As we get older, our arousal threshold goes down. When you're dealing with cancer issues, again, you have a lot of these other things that are going to wake you up. So we're trying to make the environment as conducive to sleep as possible. So mindfulness exercise, what does that mean? Well, it means being able to quiet your mind through whatever mechanism assists you with that. So again, talking to your provider, letting them know your issues. I mean, write them down so that when you go for your office visit or you do a telehealth or whatever you're doing, let them know what issues you're having. They can't help you if they don't know. And if they don't listen to you, then you need another provider. So again, very uncommonly do people relay their problems with sleep or maybe anxiety, depression with their healthcare provider. So be proactive and do that. We are there to help you. I mean, that's our career. That's what we've chosen to do in life. So you need to communicate your concerns because they aren't going to know it by telepathy. So these are the various questions you can ask. Why am I having trouble sleeping? I think we've gone through some of those reasons. What are the steps I can take to sleep better? We do have sleep cognitive behavioral therapists, unfortunately not locally in Canton. The Behavioral Health Center in Atlanta has cognitive behavioral therapists for insomnia that are helpful. And would a sleep aid be appropriate? I am not for sleep aids in the general population. However, in people going through a temporary difficulty, there's nothing wrong at all with taking a sleep aid or an anxiety medication or a medicine for depression if you're suffering from those issues. So again, counseling, being part of a group that is having similar difficulties or formal counseling with a psychologist is perfectly fine to do and should be sought out. People do various relaxation therapies, and she talked about your access to yoga and meditation resources and whatnot. And then again, sleep aids are helpful in the short term. So resources, she talked about many, many resources that are available to you guys. And I would definitely be proactive and reach out for any help you can get. This is a tough time you're going through, and there are resources out there, but they don't help anyone if the person doesn't access them. I think that's a wrap, John, for me. I'll take any questions.
Hey, Dr. Rossrocker. Yeah, great job. That was a lot of great information that we went through. I'll briefly talk just a little bit about Northside. So we actually have sleep center locations in Canton, Cumming, Roswell, Sandy Springs, and then our newest lab that we just opened in Gainesville. We have a network of 15 physicians that are boarded in sleep medicine that are a part of our sleep program. And we offer in-lab testing, we offer home sleep testing, and then we also do CPAP setups and CPAP supplies for patients that have sleep apnea. And we have built our labs on the model of trying to make it feel like a Marriott hotel, just trying to make it as comfortable and as close to home as it can be for people. We offer breakfast in bed for patients that are staying overnight. They've got individual thermostats so they can get the room as cool as Dr. Rossrocker suggested. They have big screen TVs, of course, that we turn off prior to sleep as recommended, Wi-Fi, adjustable sleep number beds, all the comforts of home that we can do to make it as good of a stay as possible. And so ultimately, if you are having sleep problems or if someone obviously please come see Dr. Rossrocker or certainly one of our sleep physicians, and we'll certainly do our best to help. We do have some questions that have been sent in, and Dr. Rossrocker, I know you touched on this a little bit, but I know it's a popular question, but in regard to sleep aids. So are there any over-the-counter medications that patients can safely take along with potential other prescriptions to help them fall asleep at night? That was one of the questions that was sent in.
Right. So the over-the-counter sleep aids are fine in the short term. There are studies that show that chronic use of over-the-counter sleep aids may, I don't know how accurate these studies are, but may possibly increase the risk of mental health problems down the road, like Alzheimer's and things like that, like Benadryl. But in the short term, I see no problems with over-the-counter sleep aids. However, if they are not effective for you, including somebody had a question about melatonin, if they are not effective for you, reach out to your provider for something stronger, basically. Again, this is a short-term situation. I don't recommend long-term sleep aids. I think it's far more effective, and this has been shown in many studies, to manage sleep difficulties with cognitive behavioral therapy, sleep hygiene management, all the things we kind of touched on, if it's a chronic problem. 100 years ago, sleep aids would not have been available, and somehow people survived without them. Although now it seems that 50% of people take some form of a sleep aid, which wouldn't even have been possible 100 years ago. So we try to really rely on behavioral management. But again, in the short term, sleep aids are fine. If over the counter, most of those things contain antihistamines, which are fairly safe. But often you can have a lag over effect, and you have to be careful with all the other medicines you may be on in management of your cancer or anxiety, depression, pain. So you have to be careful about that. And certainly whatever you're taking, your physician should be made aware.
That's helpful. Thank you. Is it another question that was posed that piggybacks off of that question, but is it possible to become dependent on melatonin to fall asleep at night?
So your body makes melatonin, okay, your pineal gland. And when you take exogenous melatonin, it kind of suppresses that. So I don't know, and I actually looked that up. I don't know studies that show that you become dependent on it, like on a narcotic or something like that. But it makes sense that it would take some time for your own body to make its own melatonin again if you chronically took melatonin. And so, I actually took melatonin once. Maybe that wasn't long enough to see if it helped me. I was having some issue years ago, but it didn't seem to help me. But some people swear by it. I don't think it's probably the least harmful thing that people can take. but I don't know how effective it is. And actually people start taking higher doses that are actually less effective than lower doses, and can cause problems with liver and things like that. So we don't want people taking more than 5 milligrams a day chronically.
Okay, that's helpful. So this question, I have a history of snoring that now wakes me up at night. How do I know if a CPAP machine is necessary? And if so, who do I speak to?
So if anyone has an issue with sleep, trouble going to sleep, staying asleep, or being sleepy after having a sleep period, and they snore, they should definitely be evaluated for possible obstructive sleep apnea. It is so common, especially as we go into middle age. Our muscles get flabbier, unfortunately, unless we're actively doing something to prevent that. Your airway is surrounded by muscle. Your tongue is a huge muscle. Your airway is surrounded by muscle. And as we go into middle age, our airway is very small anyway, about 9 millimeters. And in deep sleep, we lose muscle tone so that we don't act out on our dreams. Unless you have REM behavior disorder, you're actually paralyzed in deep sleep so that you don't act out on your dreams. So in deep sleep, your airway actually becomes as flabby as it's going to be because there's no muscle tone. And that causes your airway to kind of collapse on itself, which is apnea. So, and it's far more common than people think. And should be definitely evaluated. If there's an issue with sleep, any snoring, definitely witnessed apnea, and tiredness during the day or not feeling refreshed during the day. It's a very, very common disorder and can be easily effectively treated either with continuous positive airway pressure, which is just like running water through a hose. It's harder to kink it off. Airway devices, dental devices, and now the newer Inspire device, which is like a pacemaker for the back of the tongue, brings it forward. That's a new option in the last 7 years that has come available. So if you've had sleep apnea in the past and you're like, forget it, I'm not wearing that thing, forget it, I'm not doing it. The machines now are much quieter, they're smaller, the masks are much more workable, and then there's hundreds of masks that you can choose from. So it's not like the dinosaur days of 10, 20 years ago. So if you have had a diagnosis of apnea or think you have apnea, definitely seek help with that, because there are people that, I mean, it changes their life. I mean, it completely. I have a guy who owns a business. I have many people that get treated for their apnea, and they're like, the next day, I had one gentleman text me and said, oh my gosh, I feel like Superman. I had no idea I was going through my life with a blinder. You know, I had no idea. And now they feel good, they're energetic. And that doesn't happen for everyone, but it happens for a lot of people. And sometimes you don't realize how bad you feel until you get treated. It's kind of like your vision. You know, sometimes you don't realize you're not seeing so good until you get an eye exam and glasses, and you're like, oh my gosh, I had no idea. You know, I just thought it was old age or, you know, something like that.
Here's another question that actually came in the chat box. So it said, you mentioned sleepwalking. Is it true that you should never wake someone when they are sleepwalking? Okay,
well, you don't try to shake them out of it. Okay, you just try to gently guide them back. So if someone is sleepwalking, that's a parasomnia. That's very common in childhood. I remember waking up at the bottom of a closet many times in my, when I was 10 years old. So sleepwalking is very common in childhood, tends to go away in adulthood, but some adults do sleepwalk. And that can be just regular sleepwalking. It can also be, depending on what they're actually doing, it can be a side effect of certain sleep medications like Ambien. People sleepwalk and sleep eat, do various things during their sleep that they would not normally do. People can have REM behavior disorder where they don't get paralyzed in deep sleep and they start acting out crazy, acting out their dream, hitting their bed partner, hitting the wall, things like that. And those things definitely need to be addressed. Sleepwalking as an adult should be actually evaluated because you can harm yourself. Sometimes people that sleepwalk as an adult, you have to make the bedroom environment safe for them. You know, sometimes you have to put mattresses, you know, along the bed, and remove the nightstand, and put a bell on the door so you know if someone is walking out, you know, and maybe they're on an upper level, you know, you know, upper bedroom, and then they're going to fall down the stairs, things like that. So it is an issue, and needs to be evaluated. But you don't shake them out of sleep. You just same thing with terrors for a child, night terrors where they're just screaming and feel like you think they're just having such a difficult time. You try to get them out of it, but you can't. You just have to let it go, okay? And that's something, again, that they'll grow out of, and that's usually just in childhood. My son had that. I didn't know at the time. I wasn't informed on sleep, and I didn't know what that was, and I tried to wake him out of it, but there's no use in doing that because you can't, and it'll end, and they'll go back to sleep, and they won't remember it.
Right. I remember those in my daughter. Those were scary moments
Yes.
for everybody.
Especially if you don't know what they are.
Yeah, sure. So we've got more questions that were sent in earlier. There's another one in the chat box right now. It says, do you need a referral from a doctor to go to the sleep center for evaluation, or can you set up an appointment directly?
No, you'd have to have an evaluation from a sleep physician in order to get a sleep study done. I say sleep physician, that's not correct. Any physician, because certain things have to be documented for an insurance company to pay for a sleep study. Many sleep physicians like to see the person before ordering a study, because what we order, you know, might be a home study, it might be an in-lab study. We might specifically look for certain things depending on the patient's history. Tell the technicians, I'm worried about seizures during sleep. I'm worried about REM behavior disorder. I'm worried about restless legs and leg movement disorder. You know, so sometimes if we get a better history, we'll know what to order and where to order it. But many primary care physicians order sleep tests as well, and that's perfectly fine and good for them to have an awareness and get the ball rolling on things. And then if there is a sleep disorder, then they will refer on usually to, you know, someone like myself that is sort of certified in sleep.
Sure. Makes sense. All right, let's see. So here is one that was sent in earlier. So chemo fatigues me during the day, which leads to daytime napping and then difficulty falling asleep at night. Any suggestions on how to better handle my daytime fatigue and help fix this cycle?
So this is similar somewhat to patients with other illnesses like rheumatologic illnesses, chronic fatigue syndromes, fibromyalgia, you know, people that have chronic fatigue, okay? It's almost universal in chemotherapy patients. So the question is, how much does your difficulty sleeping at night disrupt you? You know, like let's say you have to work during the day, or you have to take care of your children during the day, or you have a schedule that you have to keep because of certain responsibilities. Then your nighttime sleep matters a lot, and we try to really avoid napping during the day. And but for someone who is temporarily going through 6 months of chemo or whatever the issue is, like I said earlier, you know, let your body sleep when it needs sleep. You don't have to necessarily be on a schedule unless that's important to you. If it's important to you, then you have to try to limit daytime sleeping as much as possible. Sometimes people are so sleepy during the day that literally, you know, they may just fall asleep while they're eating, or fall, you know, and have it be a danger to them, which we don't want. So if you're sleepy, you know, you need to sleep, especially during a temporary situation. And also, obviously, this is not chronic fatigue, but if you happen to be someone who is getting adequate sleep, but is sleepy during the day, you know, falling asleep at inappropriate times, that's not normal. And that may be idiopathic hypersomnolence, that may be narcolepsy. You know, all of those things need to be officially evaluated. I wish I had a magic shot for fatigue. I don't, and I don't think anyone does, but make sure that your blood count is as good as it can be. Try to do some form of exercise during the day to maintain that aspect of your health. And then if you need to take a nap, and don't worry too much about getting your 8 hours at night. Just take it when your body is telling you it needs it. Unless it's, of course, fatigue from depression. If it's fatigue from depression, which sometimes a person doesn't know one way or the other, that needs to be evaluated, because the depression can be treated and improve your fatigue.
That's a good point. So here's a question in the chat box. I'm experiencing an issue falling asleep as a result of medication. How long after stopping the medication should I expect to see an improvement?
Typically speaking, and I use a lot of steroids out of necessity in my patients with COPD and asthma and interstitial lung disease, different things where we just don't have any option but to use steroids. But typically speaking, that's a short-term situation. The half-life of steroids is really not very long, a couple days at most, depending on what type of steroid you use. So that should not be a long-term problem. However, what does happen when you have delayed sleep onset from medication is that your body very quickly adjusts to what sleep pattern you have. So even though the medication is gone, your body is now accustomed to not going to sleep until such and such a time and having difficulty and anxiety maybe about going to sleep. So even a short trip, over several time zones that creates a problem with sleep onset can be perpetuated, even when you're back home, so these things get set up very quickly. Your rhythms, your circadian rhythm, and how your body expects things to happen. I give the example of a baby who's finally sleeping through the night, and then it gets a cold and the parent gives it a bottle. Couple nights in a row, the cold goes away, but that baby's going to wake up for that bottle again, okay? Because that's what its body has quickly adapted to. So that is more the problem than the medication after it's gone.
Makes sense. Here's another interesting one. So what are potential causes of night terrors in adults? Is it possible to develop these without history as a child?
It's always possible to develop anything. Is it common? No, it's really not. And you would also want to look at medications that they may be on. Sometimes antidepressants can cause parasomnias in adulthood that were not there previously. It is possible for night terrors to persist, but very uncommon. And I would be looking for reasons why that might happen. Is it a night terror? Is it REM behavior disorder, which also can be a early sign of Parkinson's type neurodegenerative problems? It can also be associated with certain antidepressants. So it's not common and should be evaluated. I for example, don't have any active patients or I have not had any patients actually with sleep terrors. You have people that have post-traumatic stress disorder that might seem like they're having a sleep terror, but typically those are more definitive dream terrors.
So it looks like it's 12:59. We got one more question that was sent in. So my hormone therapy causes severe hot flashes and night sweats that wake me at night. Is there any way to help me sleep through these or ways to make them any more tolerable?
So for my own self, I can definitely speak to this question. I actually went through infertility treatment as a physician in my 30s, early 30s. And I remember going up the stairs of the hospital and I was wearing a tank top like this. And I just all of a sudden broke out in a sweat. And I'm like, what the heck is going on here? Well, I didn't realize because I just wanted to put the infertility thing away and I didn't go into the medical issues of that at all. I just let the doctors do whatever they do. And I realized I was having intense hot flashes. I mean, it was awful. And then now that I'm menopausal, I'll give you an example. We have a fan in our bedroom and I keep it 60 degrees. And then we had this outside fan, outdoor fan, the big industrial fan, and I brought it up to the bedroom and put it right by my bed. And my husband goes, Jill, this is getting out of hand. I said, well, you deal with this then, because I mean, it's hot, cold, hot, cold. I mean, it can be 10, 15 times a night. It's just so debilitating. Now, I never took anything for it. There are various over-the-counter preparations that my sisters have taken that they think help them. There's some antidepressants actually that people have taken that can help with hot flashes. I just figured I would tough it out, but it is very debilitating. And certainly if it's an ongoing thing, like some people with prostate cancer that are on hormonal therapy, I would definitely try, those things. The intensity for me was not that long. I still have them, but not nearly like it was, when I was using the industrial fan. So I just figured that would eventually get better. But there are some people take amitriptyline, Wellbutrin, other types of antidepressants have been shown to help with hot flashes. So I would ask your provider about that.
Very, very helpful. Well, Dr. Rossrocker, thank you so much. Katie, are you still on? I was going to welcome you back here at the end.
I am, yes. Thank you guys both so much for today's program. I think so much helpful information, always a lot of good questions about how to get the best quality of sleep. So thank you both for being here to facilitate this conversation. I did enter a link in the program chat box. If everyone could click through and just take a quick survey about today's program, it helps our headquarter company, Cancer Support Community, tailor these programs to make sure the information we're sharing is the most relevant to your needs. So if you could click through that link and take that survey. Again, a recording of today's program will be uploaded to our website, cscatlanta.org. So feel free to share that with anyone who missed the live recording, and also feel free to browse through the other videos available. Thank you, Dr. Rossrocker, so much for sharing your time and expertise. Thank you, John, for being here to help facilitate this conversation. We hope to see you guys all again soon. Thank you.
Enjoyed it very much. Thanks for sharing.
Yes, thank you.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org. Or follow us on Facebook. We'll be sharing additional information on upcoming programs.